Hello everyone, Gabby here from bootcamp.com, and today's video will be talking about an infection or thrombosis of the cavernous sinus. So here we can see the cavernous sinus, and here we can see the facial vein. And we know that the facial vein does have some connections with the cavernous sinus via the superior and inferior ophthalmic veins. So here we have the superior ophthalmic vein, and here we have the inferior ophthalmic vein. Now, the connections between these veins are a little bit special in the sense that these veins are essentially a valveless system. So we have no valves preventing the retrograde blood flow to occur within these areas. So if we do have some type of infection that enters into the areas of the facial vein, it can spread through the ophthalmic veins and eventually into the cavernous sinus. And this is why we refer to a specific area of the face called the danger triangle of the face. And the danger triangle of the face essentially encompasses the areas of the corners of the mouth all the way up to the bridge of the nose. And the reason that it's called the danger triangle of the face is because we have the facial vein right over here and here that are traveling within this danger space and moving more medially to get to the corners of the eye. So for example, if we have this big pimple, if we have a big pimple along the danger triangle of the face and you're popping in, you keep picking at it, and maybe some bacteria or, viruses could actually enter into that, that open wound or into that pimple, and can eventually impact that facial vein that travels within that danger triangle. We can then get spreading of that infection into the areas of the cavernous sinus due to that valveless system. So infection can occur and spread to the cavernous sinus, but if we also have some type of blood clotting or thrombosis that occurs in the facial vein, that blood clot, the thrombosis, can eventually travel into the cavernous sinus and also cause thrombosis of the cavernous sinus. So I wanted to show you here how the facial vein and how we have some other connections to the cavernous sinus. So we can see here I've drawn for us a little schematic here for the veins. And I want to mention that first we're going to see the common facial vein here. And the common facial vein will continue, eventually travel along the areas of the mandible, where it will then form the facial vein. The facial vein will again travel more superiorly and more medially to get to the corners of the eye. But before it gets to the corner of the eye, it is going to give off this deep facial vein over here. So we're going to follow that facial vein as it continues to ascend eventually to the areas of the eyes, where it will then give off the superior and inferior ophthalmic veins. As I mentioned in the last slide, the superior and inferior ophthalmic veins are going to connect with the cavernous sinus. And this is where we get that infection spread or that thrombosis spread that can occur between these areas. Now, the cavernous sinus does have some connections with the pterygoid venous plexus. Now, all those veins that you're seeing in this area here contribute to that pterygoid venous plexus. And that pterygoid venous plexus sits on top of the pterygoid muscles within the infratemporal fossa. And we do have some connections here between the cavernous sinus and the pterygoid venous plexus via these emissary veins. So we can see here that the superior ophthalmic vein drains directly into this cavernous sinus, and then the inferior ophthalmic vein is going to go ahead and drain into the pterygoid venous plexus. So infection can spread into the pterygoid venous plexus and into the cavernous sinus. Now, the pterygoid venous plexus contributes to the maxillary vein. So right over here is going to be the maxillary vein, and we can see these different tributaries of the pterygoid venous plexus to the maxillary vein. And eventually from the maxillary vein, we're then going to form the retromandibular vein. So one of the tributaries of the retromandibular vein include that maxillary vein. And we can see here that the retromandibular vein is going to divide into an anterior and posterior branch. So here's the posterior, here is the anterior. And then eventually the anterior portion of the retromandibular vein can then drain and tribute to the internal jugular vein. So you can see here how we have a bunch of different connections between all these different veins. And we know that any infection that occurs in the areas of the facial vein can eventually travel to the cavernous sinus or even to that pterygoid venous plexus. So here I want to also show you the location of the cavernous sinus. So here we can see the cavernous sinus has some connections with all the other dural venous sinuses. So if infection does enter in the cavernous sinus, it can also spread into other areas of the dural venous sinuses. Now, in order to fully understand the clinical implications of an infection or a thrombosis of the cavernous sinus, it's important to note which structures are passing through the cavernous sinus. And an easy way to remember the structures is to use a mnemonic OTOM-CAT. So I want you to have a look here at this frontal or coronal view of the cavernous sinus. So the cavernous sinus is represented here in blue, going to be sitting adjacent to or lateral to the pituitary gland, where it actually sits within that hypophyseal fossa. Now, if we have a look within the cavernous sinus, we can see some structures that are found within the sinus along the lateral wall, and we also see some structures that are found more medially. So to remember the structures that are found along the lateral wall, I want you to use the mnemonic OTOM. So along the lateral wall, we have the oculomotor nerve, so cranial nerve 3, that's the O. T for the trochlear nerve, so cranial nerve number 4. We can also see the ophthalmic nerve, so ophthalmic nerve, which is cranial nerve V1, so the ophthalmic branch of the trigeminal nerve, and then the M is going to stand for the maxillary nerve, or the maxillary branch of the trigeminal nerve. So all these structures are running along the lateral wall of the cavernous sinus, and you can use the mnemonic OTOM. Now we have some other structures that I mentioned that are traveling more medially and traveling really through the cavernous sinus. And to remember those, we can use the word CAT. So if we think of C, carotid artery, so we have the internal carotid artery over here that is traveling through the cavernous sinus. We can then also see immediately inferior to the carotid artery, we're going to find the abducens nerve, also known as our cranial nerve number 6. Now the reason that I have T here is that I want you to remember that the abducens nerve essentially is usually around the same level as the T in TOM. So the T in TOM is the trochlear nerve. So usually the trochlear nerve, I know in this image is a little bit lower, but usually the trochlear nerve and the abducens nerve are running pretty much side by side, but the trochlear nerve, like I said, is more lateral, and the abducens nerve is more medial and traveling really through that cavernous sinus. So if we think of all of these implications, if we do get an infection spread, a thrombosis, for example, or even some type of rupture of an aneurysm of an internal carotid artery, we can impact all of these structures that are found within the cavernous sinus, so all of these cranial nerves. And if you know what the functions of the cranial nerves are, you could probably guess what kind of deficits will occur. So again, as I mentioned, the causes include infection. So most commonly, Staph aureus is a bacterial infection that again will travel from the areas, the danger triangle of the face, from that facial vein and eventually travel to the cavernous sinus. We may also get aneurysm or tearing of the internal carotid artery, which would cause some impact to those nerves that are found within that cavernous sinus. But we can also increase our likelihood for thrombosis of the cavernous sinus if we do have a patient that is more susceptible to hypercoagulable states. So they're more susceptible to forming these blood clots that will eventually go ahead and form the thrombosis of the cavernous sinus. Same would apply for the facial vein. So if we do have some thrombosis in the facial vein, that can also spread into the cavernous sinus and impact all those structures. And anyone who has poorly controlled diabetes is a higher risk for infection of the cavernous sinus. Generally speaking, poorly controlled diabetes means that the patient has high levels of glucose in their blood. And that high levels of glucose provide an excellent environment for fungal growth to occur. And a common fungus that is usually associated with this poorly controlled diabetes includes this mucormycosis rhizopus. Now, earlier we talked about the contents of the cavernous sinus and how infection or thrombosis of the cavernous sinus can impact the structures that pass through. And that's what dictates our clinical presentations. So if we think of the functions of all of these cranial nerves, they're all going to the eye. So what you're going to expect is you're going to see some type of deficits that occur at the level of the eye. So in this case, we can get an increased intracranial pressure. We could also get fever, and we could also get some pain and degree of paralysis with eye movements, right? Some of these nerves, like cranial nerve 3, 4, and 6, contribute to the motor innervation of the extraocular muscles. So if we have impairment or damage to these nerves as they're passing through the cavernous sinus, we'll eventually have or cause this pain or this degree of paralysis with these eye movements. Next, we can also see some type of loss of facial sensation because we know that cranial nerves V1, so our ophthalmic branch, and cranial nerve V2, also our maxillary branches of our trigeminal nerve, will contribute to the sensory innervation of the face. So if we do have some infection in the cavernous sinus, can damage those nerves and sensory innervation can't occur. And then lastly, we may see an absent corneal reflex because we know that the corneal reflex is carried, or those fibers are carried from that cranial nerve V1 or ophthalmic branch of our trigeminal. All right, so let's see what you've learned today. So which of the following cranial nerves does not pass through the cavernous sinus? And then lastly, a 29-year-old male patient presents with a swollen face, fever, and double vision. Upon examination, you notice that the left side of his face is markedly swollen, and he has developed proptosis, so bulging of the eye, ophthalmoplegia, so inability to move the eye, and chemosis, so conjunctival edema within the left eye. He reports a recent dental infection, and imaging studies reveal thrombosis within the left cavernous sinus. Thrombosis of which vein most commonly leads to thrombosis of the cavernous sinus in this patient. So pause the video, come on back when you're ready. So for that first question, the one nerve that does not pass through the cavernous sinus is the facial nerve. Right? We did say that some of the clinical presentations that may occur includes the absence or loss of sensation of the face, but that is due to the branches of the maxillary nerve as well as the ophthalmic nerve as it's passing along the lateral wall of that cavernous sinus. But the facial nerve itself is coming off the brain a bit more posteriorly and does not pass through that cavernous sinus at all. And that being said, the facial vein is going to be one of the veins that contribute along the areas, the danger triangle of the face, and where we can get, if we have infection in that vein or we have thrombosis of the vein, it can carry to that cavernous sinus due to the connection via the superior and inferior ophthalmic veins. So here are the references for the images that I used today, and I hope you enjoyed this lesson. Please let us know if you have any questions.